Good morning, everyone. I'm Dr. Deepak, Assistant Professor Pathology, Malad Institute of Medical Sciences. Today, we are going to discuss about genetics. It's a very important topic to learn. Uh, Gregor John Mendel is the father of modern genetics. He was the pioneer, and you also know he's a father. He came up with something called Mendelian laws, which are very important. So we will be covering the basics first. There is a chromosome with two identical arms. Shorter arm is called P arm and the longer arm is called Q arm with the central centromere, and each chromatid will have DNA molecules coiled, and this is the basic structure of the chromosome. So human germ cells, that is ova and sperms, they contain 23 chromosomes, that is haploid, and whereas all nucleated somatic cells they have 23 pairs of chromosomes that we call something called diploid with 44 autosomes and two sex chromosomes. Female has double X and sex chromosome, and male has XY chromosome. The study of these any abnormalities in the chromosomes is called cytogenetics, and any abnormalities here is called cytogenetical abnormalities. Basically, it is a study of any defects in the karyotype. So we'll know what is karyotyping. What is karyotyping? Karyotyping is nothing but it's a study of chromosomes. And karyotype, it is like photograph, that is photograph of chromosomes which are arranged based on their lengths. And why it is shown that it is ideally done in metaphase stage of the cell division. Why? Because in metaphase the chromosomes are widely spread and clearly visible. Okay, this is a normal human chromosome. As you can see, there are um, uh, the chromosomes are arranged in a decreased length, and last one you see XY and XX in females. These are sex chromosomes. These are autosomes and sex chromosome. It's a basic human, normal human karyotype. So we know that there are different types of chromosomes. That is metacentric with centromere in the center with two equal sides of the chromatids. Submetacentric where centromere is more towards the one side, in which one side being short and the other side being long. And acrocentric, they are almost near the end of one side of the chromosomes. And centromere, that is telocentric, that is centromere arranged completely at the other end. So these are four types of chromosomes. What is aneuploidy? Aneuploidy, we have to learn about this because it is any number other than haploid and diploid. We call it as aneuploidy. So for example, n plus n, n plus 1, n plus, for example, if we have 22, if we have 23, that is aneuploid. N minus 1, 21, the same. Anything other than haploid and diploid is known as aneuploidy. Where can it occur? It occurs due to non-disjunction. The division of the chromatids causes aneuploidy. Where can it occur? It can occur in meiosis 1, and it can also occur in meiosis 2. If it occurs in meiosis 1, we get n plus 1, n plus 1, n minus 1, n minus 1. As you can see, the division is not equal. Whereas if it occurs in meiosis 2, here you can see one daughter cell had 3, the other one had 1, the other one 2. These are the normal. So this is an aneuploidy non-disjunction. So what are the chromosomal aberrations? We learn chromosomal abnormalities based on two headings. One is autosomes and sex chromosome. Defects in the chromosomes, that is autosomes, and defects in sex chromosomes. In autosomes, we learn in three headings, that is trisomy 21, trisomy 18, and trisomy 13. Whereas in disorders involving sex chromosome, such as Klinefelter syndrome, Turner syndrome, hermaphroditism, and pseudohermaphroditism. So we'll go one by one. trisomy, that is Down syndrome. It is one of the most common chromosomal disorders, and it's a major cause of mental retardation. Here, the chromosome in karyotype, you will see the chromosome count is 47. That is aneuploidy. So where does it occur? Meiotic non-disjunction of chromosome 21. That's why we call it trisomy 21. Occurs in the ovum. Both of the parents of such children have normal karyotype and they are normal in all other aspects. So there is a problem in the ovum. So this comes into the daughter cell. So this graph shows as the age of the maternal age increases, we will see the increase in the incidence of mental retardation, that is Down syndrome in this. Uh, so it is one of the major risk factors, maternal age, increasing maternal age. So what are the diagnostic clinical features? What we have here is flat facial profile, oblique palpebral fissures, epicanthal folds. That is, it's a condition called Mongolism because it resembles the people of Mongolia, and it causes severe mental retardation where the IQ is from 25 to 50, decreases as much. And we can see a lot of congenital heart diseases. That is 40% of these cases has congenital heart diseases. For example, septal defects, which can be arterial or ventricular, or any or valve malformations, or there is a endocardial cushion defect. There is ostium crack. So there is mental retardation, sure, and there is also the deaths occur due to these cardiac problems. That is one of the major cause. And GAT also, we can see few defects, that is atresia of esophagus on small bowel. And we can see acute leukemia is increased 10 to 20 times increased risk in these patients when compared to the normal people. That is AML and ALL, acute myeloid leukemia, acute lymphoid leukemia. And these people are more risk to they have more risk to the Alzheimer's disease in the future as they grow older. And we can see a lot of autoimmunity disorders in this, for example in lungs and thyroid like Hashimoto's or lymphocytic thyroiditis. So this is a karyotype of the Down syndrome, where you can see there is this is a 21st chromosome type, which is showing trisomy. To summarize here, that is, we have mental retardation, they have abundant neck skin, epicanthal folds, and flat faces. We have simian crease, where the palm shows only one crease, prominent one, instead of normal two. And we have congenital heart diseases, intestinal stenosis, umbilical hernia. I told you GIT defects will be there, and they have predisposition to leukemias and hypotonia. They'll have muscle weakness. So this is up slanting palpebral fissure, that is moving towards the up slanting, low set ears, short neck, epicanthal fold. This is called the condition called Mongolism, and they have flat nasal ridge. And one thing you have to remember here, there's called brushfield spots, the white spots in the eye. Yeah, they are typical of this Down syndrome. The other examples of the trisomies are trisomy 18, which is known as Edwards syndrome, trisomy 13, Patau syndrome, and chromosome 22, long arm 11 deletion syndrome. That's 22q11 deletion syndrome. There are two examples for this chromosome 22q11 syndrome, that is Dijor syndrome and velocardiofacial syndrome. In Dijor syndrome, we have to remember catch 22, cardiac defects, abnormal faces. They have thymic aplasia, and they have cleft palate, and they may have hypocalcemia or hypoparathyroidism. Whereas in velocardiofacial disease syndrome, we have flat faces, they are dark under as dark circle under eyes, they have prominent nose. All these features they occur due to the deletion of the 22 long arm. And we'll discuss about Edwards and Patau syndrome. Edwards, they have intellectual disability, and they have something called rocker bottom feet, which we'll see in a bit. Then they have cleft palate, clench fists and their fingers are so long and they are covered. And it looks like scissors hands. They have prominent occiput. These are the features. See, trisomy 18. They have also have low set ears, microcephaly, small heads, micrograthia, and the lower jaw will be less prominent compared to the normal GI abnormalities, and they might have horseshoe shaped kidney. So in trisomy 18, to summarize, we have overlapping fingers. We call it scissor hands. Low set ears, decreased muscle tone, small in size, heart and lung abnormalities, and also club feet. See here, we can see the foot is like a chair, some rocker bottom chair. How it looks, they have this club feet called rocker bottom feet. Tau syndrome. This is chromosomal 13 abnormalities with intellectual disability, microcephaly, holoprosencephaly. Holoprosencephaly means normally when we develop, the brain develops into right and left hemisphere. But in these Tau's infected children, there won't be any separation. The whole thing, the frontal cortex of the brain will be as one. It won't be divided into two hemispheres, and they may have polydactyly and cleft palate and cleft lip. So to summarize Patau syndrome, they have small eyes, smaller than normal, cleft lip and cleft palate, microcephaly, small head with intellectual disabilities. They may have polydactyly, 6 fingers or more, rocker bottom feet. In few cases, we see rocker bottom feet here, as we have seen in Edward syndrome. And then umbilical hernia, renal defects can be seen in Patau syndrome. So these were the chromosomal abnormalities which normally occur in the autosomes. So we see down Edwards, Patau, and chromosome 22, where we saw catch 22 and Velo facial defect syndrome. Now, cytogenic disorders involving sex chromosomes. These are more common compared to the autosomal, and these are chronic problems. They only come out and people can only know during their puberty, not before that. Like the autosomal disorders, where right after birth the features will be visible. They are difficult to diagnose at birth and they are first recognized at the time of puberty because they are related to the sex chromosome defects. So this remember this as a rule of thumb. The more is the number of X chromosome, abnormal X chromosomes, the more there is a greater the likelihood of mental retardation in normalities. So there are two cases here. You have to remember: Klinefelter syndrome and Turner syndrome. Klinefelter syndrome is 47XX. This is a karyotype. You see the sex chromosome. We have two X and a small Y. Small Y chromosome is always small when compared to the X. So this is a karyotype. So how do you define Klinefelter syndrome? It's defined as male hypogonadism that occurs when there is two or more X chromosomes or one or more Y chromosome. There may be 47 double X double Y, but they are rare compared to the 47 double XY. And then there may be testicular dysgenesis. The testicles which they develop are not normal and they are really diagnosed before puberty. So how do they look? They have elongated body. We call it as euchanoid body habitus, where lower half of the body is greater than the upper segment, and they have small atrophic testes with small penis, and they lack secondary sexual male characters such as deep voice, beard, and male distribution of pubic hair. And these people can show gynecomastia. You have to remember they are more prone for the type 2 diabetes and metabolic syndrome. And mitral valve prolapse may occur in around 50% of adults. Elevated FSH can see in these, and decrease in testosterone levels are decrease when compared to the estrogen levels. So the ratio of estrogen to testosterone level, the more it is the ratio, the more is a degree of feminization in these individuals. So important genetic cause of reduced spermatogenesis and male infertility. So it is one of the cause. So to summarize here, we won't see the frontal baldness present in the normal males. So they'll sparse beard growth, narrow shoulders, and they failure to grow any chest hair. Gynecomastia can occur in around 30% of cases. The arm span is greater than the height. They have wide hips like females, and female distribution of pubic hair, small testes, small penis, long hair, long legs, and they are tall, feminized physiques, intellectual. Intellectually, they have mildly impaired IQ. They may be absent, delayed, or incomplete puberty, and they may have osteoporosis like old females have. The one thing you have to remember is it has oligospermia and azoospermia, and decreased libido and increased risk of metabolic syndrome and hypogonadism. And what do you see in microscopy? You can see in microscopy the testicular tubules are atrophied and replaced by pink hyaline material instead of normal seminiferous tubules. So these are the pictures. These are the normal testes. It is separated by this hyaline material. So this is a Klinefelter syndrome. We'll learn about Turner syndrome and other syndromes in the next class. Until then, thank you.